that the people of Wisconsin indicated they wanted. So I don't think it's going to change the dynamics much, but the issue is about the same. And when we go into making next biennial budget, we'll have great conversations about those items that I mentioned and others, and we'll come to some conclusion at some point in time. We'll work together as best we can.
Thank you, Melanie. Now to Adriana Mendez from TMJ4 in Milwaukee. Adriana? Adriana Mendez? And a reminder, *6 to unmute your phones. And once more, Adriana Mendez from TMJ4. Okay. We'll move on and see if we can come back to Adriana. We'll move on to Will Cushman from Wiscontext. Will?
Hi there. I think this question would be for Secretary-Designate Palm. You mentioned that hospitals in every region around the state are continuing to deal with staffing shortages. I'm wondering if those shortages are being felt more acutely in certain regions and where that might be. And I'm also wondering if the loosening restrictions on out-of-state healthcare workers being able to work in state, if you're aware of that being able or having the effect of helping relieve any shortages anywhere in the state. Thank you.
Thanks, Will. So we certainly are hearing about staffing shortages, and right, they, like all of this, because hospitals are so dynamic and they're just in time, real time, monitors and navigating who's coming in, who's going out, and the staffing necessary to accommodate that very dynamic scenario in which you don't know from day to day what's going to pull up in front of the hospital necessarily. So the shortages ebb and flow similarly. It is why the deployment of rapid antigen tests is a helpful strategy as they try to manage their staffing shortages. And so it changes day to day and hour to hour, and we certainly have used a number of our both regulatory flexibilities as well as called on our federal partners to help us mitigate some of those staffing shortages when they were more chronic and going to be a little bit longer term, and it needed an asset that could be around for a couple of weeks or a month. So we're pulling all the levers. We're in close contact with the hospitals, but it is the kind of dynamic thing that changes daily and hourly for these hospitals as they very actively manage their caseloads. I would say probably the western part of the state are seeing at this point the least burden on staffing as it relates to current shortages. But again, as we see the daily number of cases climb, as we see hospitalizations rise, we certainly are at risk across the state for shortages, and folks are going to need to be prepared all around, which is the work that hospitals have been doing to get ready for this. They also, many of them have their own staffing agencies and other strategies that they're deploying. But it certainly is an issue, and as with all of this stuff, speaks to our need to do everything we can to stop the spread and stop the ultimate need for hospitalizations for more and more Wisconsinites.
Thank you, Will. And we have time for one more question, and that belongs to Jonathan Nizer from NBC 26 in Green Bay. Jonathan?
All right, thank you. This question is for Dr. Westergaard. I have a quote from the medical officer for health out of Ottawa, Canada. She said, I have written to the mayor describing the need for a new approach to the pandemic response for the sake of the population's health. We need to be learning to live with COVID, to coexist with COVID with caution. What is your response to that quote, and do you see yourself ever giving Governor Evers the same advice?
Well, we have no choice but to live with COVID. I would say that our goal on top of that is to prevent as many people of dying from COVID as we possibly can. And I think that the scientific evidence has shown us a number of ways to do that. The strategy that we've developed at DHS is to try to do all of those things as much as we can. So yes, we want to live and we want to thrive, we want to be resilient despite the fact that we're living through a pandemic, but that doesn't mean that we should let up from being aggressive on the social distancing and the mask wearing and the limiting gatherings that we do. So I don't know the full context of the quote to be able to respond to it any more than that. But yes, we need to live with COVID. We also need to try to drive the transmission of COVID into the ground so we can live, hopefully, without very much COVID in our communities. And I think we have a strategy to do that. We just need to pull it off. We need to work harder. We need to do it more aggressively to prevent transmission.
Jonathan, and that concludes today's briefing. Please continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a good afternoon.